Hello there. Today I want to talk about something that just happened, not hypotheticals, not culture war noise, but a real federal action that will immediately affect healthcare access for transgender children in the United States. I want to be very clear at the start. I am a gay man. I have very strong views about any of this being discussed in classrooms, and I have very strong views on medicalizing our children based on what is very flimsy research at best. No hormones, no puberty blockers, no surgery should be done to our kids. But that's not today's video. I'll do that video soon in detail. Today is about what the Trump administration just ordered, why it's happening, and why it is not as settled scientifically or internationally as people are often told. Here we have a headline showing RFK Jr., Trump administration moves to cut off transgender children for care. Another headline from NPR, RFK Jr. and Dr. Oz announce moves to ban gender-affirming care for young people. Today, the Department of Health and Human Services announced proposed rules that would cut off Medicare and Medicaid funding to hospitals and providers that offer gender-affirming care to minors. This includes puberty blockers and cross-sex hormones and surgeries. This matters because almost every major hospital system in the US relies on Medicare and Medicaid funding. So even in states where the care is legal, hospitals could still be forced to stop providing it, not because of state law, but because of federal funding pressure. These rules are not yet final. There's a public comment period coming, but the signal is unmistakable. The federal government is moving to shut this down nationwide for children. This is not coming out of nowhere. A lot of coverage frames this as America suddenly going rogue. That's just not true. The United States is actually late to this fight. Over the last several years, multiple European health systems have already reversed course on medical transition for minors, especially puberty blockers. The most important example is the UK. After years of internal review, the UK's National Health Service concluded that the evidence supporting puberty blockers for children was too weak and uncertain to justify routine use. As a result, the NHS stopped prescribing puberty blockers to minors outside of very tightly controlled research trials, and those restrictions were later made indefinite. This wasn't driven by right-wing activists either. It was driven by their national health system, reviewing the data and deciding that the risk-benefit case simply wasn't there. And the UK is not alone. Countries like Sweden and Finland have also tightened their guidelines. Here's Sweden, gender reassignment of children is a big experiment, and they have cut down Swedish U-turn on gender transition for children. And Finland, Finns turn against puberty blockers for gender dysphoria. They've also tightened their guidelines, shifting away from routine medical transitions for minors and toward extreme caution, psychotherapy first, and medical intervention only in rare cases. So when people say this is unprecedented, it's not accurate. It's just what is different in the US is how the policy is being enforced through federal funding rather than nationalized health care. The evidence dispute, the part people talk around, this is the part that makes everyone uncomfortable, and it's why I'm doing this video very carefully. The central dispute is not whether transgender people exist. It's not whether adults can make medical decisions for themselves. This dispute is, do we actually have strong, high-quality evidence that medical transitions benefit children enough to outweigh the risks or not? In Europe, the multiple health authorities concluded the answer is no. And what we see here are the results of the CATH study, which came out, and these are the highlights that came out, and it said puberty blockers should only be used in research protocols, and that hormones should not be given to anybody until the age of 18. So they really pulled back on everything. And as a matter of fact, originally it was just a pause, and then they made the pause indefinite now. The UK's independent cast review found that much of the research supporting pediatric gender care affirming medical care was low quality, relied heavily on observational studies, and lacked long-term outcome data. And long-term outcome data is still not even being gathered. That does not automatically prove harm, but it does mean uncertainty. And uncertainty matters when you're talking about children and irreversible medical interventions. Even supporters of this care will often acknowledge something the public rarely hears clearly. Some of these effects are permanent. On fertility, sexual function, bone development, and physical maturation. Additionally, there's been no valid study of long-term effects. No study has looked at what the effects have been on what are now adults who were treated as children. We just don't know the long-term effects. Much more research needs to be done before this should be considered safe for our children. This is not propaganda. This is biology. This is why European systems slowed down instead of speeding up. What the Trump administration is saying is, through HHS leadership, is explicitly framing this as a child protection issue. They argue that the evidence of benefit is uncertain, the potential harms are significant and mostly irreversible, and that the federal programs should not fund treatments for children that don't meet a high standard of proof. Their critics argue that this is government overreach, ideological interference, and attack on trans youth and their families. Both things can be argued. But what cannot be argued is that this debate is settled science. It simply isn't. Europe has already told us that. Just to be clear again, I'm not making my full moral or ethical case in this video. I'm explaining why this policy fight exists at all and why pretending there's universal medical consensus simply isn't honest. This isn't symbolic. Because of how Medicare and Medicaid work, this policy could reshape pediatric care nationwide almost overnight. Hospitals will not risk losing federal funding. Insurance networks will follow the federal rules, and providers will stop offering the services long before the courts weigh in. Whether you support or oppose this care, the impact will be real. What happens next? These rules will go through a public comment period. Lawsuits are guaranteed. ACLU has already announced that they're going to file lawsuits, as has HRC and a couple other organizations. I don't necessarily agree with them, but they're making their case. Make no mistake, the era of unquestioned, rapidly expanding medical transition for children is already over in much of the world, and the US is now entering that same reckoning. I'll be putting another video and I'll explain why I personally oppose medicalizing children, how my views formed, and why I believe adults failed kids in this debate. But today was about one thing: what just happened today, why it's happening now, and why pretending this simple or settled does a disservice to everyone. If you want clear, uncomfortable conversations, not slogans, please subscribe, and I'll see you in the next one. Thank you.